The first step in basic life support is option A, chest compressions, option B, checking responsiveness and calling for help, option C, giving medications, option D, applying a splint. The correct answer is option B, checking responsiveness and calling for help. Always assess responsiveness and call for emergency help before starting CPR. The first step in basic life support is checking responsiveness and calling for help. The correct compressions to breath ratio for adult CPR is option A, 15 is to 2, option B, 30 is to 2, option C, 10 is to 1, option D, 20 is to 2. The correct answer is option B, 30 is to 2. Correct guidelines recommended 30 compressions followed by 2 rescue breaths for adults. The correct compressions to breaths ratio for adult CPR is option B, 30 is to 2. The depth of chest compression in adult during CPR should be option A, 2 to 2.4 inches, that is 5 to 6 centimeters. Option B, 1 inch. Option C, 3 inches. Option D, 4 inches. The correct answer is option A. Adequate depth ensures effective circulation during CPR. The depth of chest compression in adult during CPR should be 2 to 2.4 inches, that is 5 to 6 centimeters. Hand position for adult chest compression is heel of one hand on the center of the chest, both heels on the upper abdomen. Option C, fingers only on sternum. Option D, entire palm on ribs. The correct answer is option A, heel of one hand on the center of the chest. Heel of one hand on lower half of sternum, other hand on top, interlocked fingers. The rate of compressions during CPR should be option A, 60 to 80 compressions per minute. Option B, 80 to 100 per minute. Option C, 100 to 120 per minute. Option D, 140 to 160 per minute. The correct answer is option C, 100 to 120 per minute. The rate of compressions during CPR should be 100 to 120 compressions per minute is recommended. The rate of compressions during CPR. If a person is choking and cannot breathe, the first action is option A, Heimlich maneuver, abdominal thrust. Option B, give water. Option C, perform CPR immediately. Option D, lie them down. The correct answer is option A. Apply abdominal thrust, dislodge aerial obstruction. CPR should be started immediately in case of option A, cardiac arrest. Option B, mild headache. Option C, minor cut. Option D, fever. The correct answer is option A, cardiac arrest. CPR maintains circulation and oxygenation until professional help arrives. CPR should be started immediately in case of cardiac arrest. CPR maintains circulation and oxygenation until professional help arrives. When using an automated external defibrillator, the nurse should option A, attach pads and follow voice promotes. Option B, shock continuously without instructions. Option C, remove pads after one shock. Option D, only turn it on. The correct answer is option A, attach pads and follow voice prompts. AED guides the user through pad placement and shock delivery. In infant CPR, the rate of compressions should be option A, 60 to 80 compressions per minute. Option B, 80 to 100 compressions per minute. Option C, 100 to 120 compressions per minute. Option D, 120 to 140 compressions per minute. The correct answer is option C, 100 to 120 compressions per minute. Infant CPR rate is 100 to 120 compressions per minute with the two finger technique. During CPR, the relief of airway obstruction in an unconscious adult is done by option A, head tilt, chin lift, option B, jaw thrust, option C, finger sweep only, option D, turning on side. The correct answer is option A, head tilt, chin lift. Head tilt, chin lift opens airway unless cervical injury is suspected, then use jaw thrust. During CPR, the relief of airway obstruction in an unconscious adult is done by CPR is most effective when option A, chest fully recoils after each compression. Option B, shallow compressions are done. Option C, only breaths are given. Option D, patient is seated. The correct answer is option A, chest fully recoils after each compression. Full chest recoil allows heart to refill, improve circulation. CPR is most effective when chest fully recoils after each compression. If two rescuers are present during child CPR, the compression to breaths ratio is option A 30 is to 2, option B 15 is to 2, option C 20 is to 2, option D 10 is to 1. The correct answer is option B 15 is to 2. For children and infants with two rescuers, 15 compressions to 2 breaths is recommended. The first aid for unconscious but breathing person is option A place in recovery position, option B perform CPR, option C give water, option D shake them vigorously. The correct answer is option A place in recovery position. Recovery position maintains airway and prevent aspiration. The first aid for unconscious but breathing person is place in recovery position. During CPR, interruptions in chest compression should be option A minimized, option B frequent, option C every 5 seconds, option C after every 2 compressions. The correct answer is option A minimized. Minimizing interruptions improves survival outcomes. During CPR, interruptions in chest compressions should be minimized. The most important link in the chain of survival is option A early recognition and calling for help, option B hospital admission, option C antibiotics, option D pain management. The correct answer is option A early recognition and calling for help. Early recognition of cardiac arrest and activating EMS is crucial. The first action in any bleeding control is apply direct pressure on the wound, option B elevate legs, option C give water, option D apply ice. The correct answer is option A apply direct pressure on the wound. Direct pressure is the most effective initial step to control bleeding. The first action in any bleeding control is apply direct pressure on the wound. Direct pressure is the most effective initial step to control bleeding. If bleeding is severe and not controlled by direct pressure, the next step is option A apply a tourniquet proximal to the wound, option B give analgesics, option C elevate head, option D applied cold compress. The correct answer is option A apply a tourniquet proximal to the wound. Tourniquets are used only for life-threatening extremity bleeding when direct pressure fails. If bleeding is severe, not controlled, then apply a tourniquet. A clean cut wound with minimal bleeding is called option A abduction, option B incision, option C puncture, option C laceration. The correct answer is option C incision. Incisions are clean surgical type cut with minimal tissue damage. A clean cut wound with minimal bleeding is called incision. Clean surgical type cuts with minimal tissue damage. A crust or tear-like wound is known as. A crust or tear-like wound is known as option A, laceration, option B, incision, option C, puncture, option C, avulsion. The correct answer is option A, laceration. Lacerations are irregular, often caused by blunt trauma. A crust or tear-like wound is called laceration. The first aid for nosebleed epistaxis includes option A, pinch soft part of the nose and lean forward. Option B, tilt head back. Option C, apply ice to forehead only. Option D, push tongue down. The correct answer is option A, pinch soft part of nose and lean forward. Leaning forward prevents blood from entering throat. Pinching compresses bleeding vessels. The first aid for nosebleed includes pinch soft part of nose and lean forward. A puncture wound is particularly dangerous because risk of infection and tetanus is high. Option B, bleeds profusely. Option C, causes immediate shock. Option D, heals faster than cuts. The correct answer is option A, risk of infection and tetanus is high. Deep puncture trap bacteria and may introduce tetanus spores. A puncture wound is particularly dangerous because risk of infection and tetanus is high. For a large avulsion wound, the nurse should option A, clean gently, cover with sterile dressing to control bleeding. Option B, remove all tissue aggressively. Option C, apply heat. Option D, leave open to air. The correct answer is option A, clean gently, cover with sterile dressing, control bleeding. Gentle cleaning prevents further tissue damage. Sterile dressing reduces infection. Gentle cleaning prevents further tissue damage. Sterile dressing reduces infection. If a patient has arterial bleeding, the blood will spurts in rhythm with heartbeat and bright red. Option B, oozes slowly. Option C, dark red, steady flow. Option D, B, mixed with pus. The correct answer is option A, spurts in rhythm with heartbeat and bright red. Arterial bleeding is bright red in color and pulsatile. Veins bleed dark red, steady flow. For minor abrasions, the first aid step is option A, clean with mild antiseptic and cover. Option B, apply tourniquet. Option C, give antibiotics only. Option D, apply butter. The correct answer is option A, clean with mild antiseptic and cover. Cleaning and covering prevent infection and promote healing. For minor abrasions, the first aid step is clean with mild antiseptic and cover. In case of severe bleeding from an arm, the bleeding limb should be option A, elevated above heart level if possible. Option B, lowered below heart. Option C, bent sharply at joint. Option D, left hanging. The correct answer is option A, elevated above heart level if possible. Elevation helps reduce blood flow and assist clotting. In case of severe bleeding from an arm, the bleeding limb should be elevated above heart level. Wounds that penetrate deep tissues or organs are called option A, puncture wounds. Option B, abrasions. Option C, contusions. Option D, burns. The correct answer is option A, puncture wounds. Puncture wounds penetrate skin and underlying tissues, potentially causing internal injury. Wounds that penetrate deep tissues or organs are called puncture wounds. A first aid for minor bleeding from a cut finger includes option A, wash with clean water, apply antiseptic cover with sterile dressing. Option B, apply tourniquet. Option C, leave open. Option D, apply oil. The correct answer is option A, wash with clean water, apply antiseptic, cover with sterile dressing. Proper cleaning and sterile dressing prevent infection and promote healing. Proper cleaning and sterile dressing prevent infection and promote healing. If a foreign object is embedded in the wound, the nurse should option A leave object in place and stabilize it. Option B remove forcefully. Option C push it deeper. Option D cover with hot compress. The correct answer is option A leave object in place and stabilize it. Removing an embedded object can worsen bleeding, stabilize and seek medical care. Removing an embedded object can worsen bleeding, stabilize. The purpose of sterile dressing is option A prevent infection and protect wound. Option B speed up bleeding. Option C keep wound moist. Option D cause pain. The correct answer is option A prevent infection and protect wound. Sterile dressing shields wound from pathogens and supports healing. The purpose of sterile dressing is to prevent infection and protect wound. If a bleeding wound shows signs of shock, the first aid includes option A lay patient flat, elevate legs, maintain warmth, and call emergency help. Option B give food immediately. Option C apply ice to entire body. Option D make patient walk. The correct answer is option A lay patient flat, elevate legs, maintain warmth, and call emergency help. Shock management maintains perfusion and prevents deterioration while waiting for advanced care. The first step in burn first aid is option A remove the patient from the source of burn. Option B apply ointment immediately. Option C cover with thick cloth. Option D massage the area. The correct answer is option A remove the patient from the source of burn. Removing the source prevents further injury. Safety comes first. The first step in burn first aid is remove the patient from the source of burn. Cooling a burn injury should be done using option A running cool water for 10 to 20 minutes. Option B ice directly on skin. Option C hot compress. Option D alcohol. The correct answer is option A running cool water for 10 to 20 minutes. Cool water reduces tissue damage. Ice may worsen injury. Cooling a burn injury should be done using running cool water for 10 to 20 minutes. The most painful and superficial burn is option A first degree burn. Option B second degree burn. Option C third degree burn. Option D fourth degree burn. The correct answer is option B second degree burn. Second degree burns affect epidermis and part of dermis, causing blisters and intense pain. Second degree burns affect epidermis and part of dermis, causing blisters and intense pain. A burn with white or charred appearance indicates option A third degree burn, option B first degree burn, option C second degree burn, option D sunburn. The correct answer is option A third degree burn. Full thickness burn destroys epidermis and dermis, often painless due to nerve damage. A burn with white or charred appearance indicates third degree burn. Chemical burns should be treated by option A flushing with large amounts of water at least 20 minutes. Option B applying ointment immediately. Option C rinsing with alcohol. Option D covering tightly. The correct answer is option A flushing with large amounts of water for at least 20 minutes. Immediate copious irrigation dilutes and removes chemical. Medical care is essential. Chemical burns should be electrical burn first aid includes option A ensure source is off before touching patient. Option B touching patient immediately while plugged in. Option C apply cold compress directly. Option D give food. The correct answer is option A ensure source is off before touching the patient. Safety is priority. Live electricity can harm rescuer. Sunburn is a type of option A first degree burn, option B second degree burn, option C third degree burn, option D electrical burn. The correct answer is option A first degree burn. Sunburn damages only the epidermis, causing redness and pain. Sunburn is a type of first degree burn. Sunburn damages only the epidermis, causing redness and pain. In case of burn blisters, the nurse should option A avoid popping blisters, option B pop immediately, option C apply ointment without cleaning, option D applying ice directly. Option A avoid popping blisters. Blisters protect underlying tissue and reduce infection risk. In case of burn blister, the nurse should avoid popping blisters. Large burns requiring fluid resuscitation are usually option A more than 10% of body surface area in children, more than 15% in adult. Option B 1 to 2% only. Option C any minor burn. Option D only chemical burns. The correct answer is option A more than 10% of body surface area in children, more than 15% in adult. Extensive burns cause fluid loss and shock. IV fluids may be needed. After burn, first aid, the next important step is cover with sterile non-stick dressing and seek medical care. Option B apply butter. Option C leave open to air. Option D massage vigorously. The correct answer is option A cover with sterile non-stick dressing and seek medical care. Sterile dressing prevents infection and support healing while waiting advanced care. The first aid for a fractured limb includes option A immobilize the limb, control bleeding and seek medical care. Option B move the limb frequently. Option C apply massage. Option D force the limb into normal position. The correct answer is option A immobilize the limb, control bleeding and seek medical care. Immobilization prevents further injury, reduces pain and avoids complications. Immobilization prevents further injury, reduces pain and avoid complications. A fracture where bone pieces penetrate the skin is called option A closed fracture, option B open or compound fracture, option C green stick fracture, option D hairline fracture. The correct answer is option B open or compound fracture. Open fractures expose bone, increasing infection risk. Emergency care is essential. A fracture where bone pieces penetrate the skin is called open fracture or compound fracture. A green stick fracture commonly occurs in option A children, option B adults, option C elderly, option D infants only. The correct answer is option A children. In children, bones are soft and may bend, causing an incomplete fracture. A green stick fracture commonly occur in children. The purpose of splinting a fractured limb is option A prevent movement and reduce pain, option B heal bone immediately, option C increase circulation, option D causing swelling. The correct answer is option A prevent movement and reduce pain. Immobilization stabilizes the fracture, reduces pain and prevents further injury. The purpose of splinting a fractured limb is prevent movement and reduce pain. In case of suspected spinal injury, the first aid includes option A keep the patient lying flat and avoid movement of spine. Option B sit the patient upright. Option C, roll patient frequently. Option D, bend the neck. The correct answer is option A, keep the patient lying flat and avoid movement of spine. Minimizing spinal movement prevents paralysis or worsening of injury. In case of suspected spinal injury, the first aid for dislocation includes option A, immobilize joint and seek medical help. Do not attempt to reduce. Option B, try to pop joint back into place. Option C, massage vigorously. Option D, apply heat immediately. The correct answer is option A. Untrained reduction can cause nerve or blood vessel damage. Immobilize until professional care. Signs of fracture include option A, pain, swelling, deformity, and loss of function. Option B, only redness. Option C, only bruising. Option D, nausea. The correct answer is option A, pain, swelling, deformity, and loss of function. Classic fracture signs includes pain, swelling, abnormal positioning, and functional loss. A hairline fracture is option A, small crack in the bone without displacement. Option B, complete break of bone. Option C, fracture with bleeding. Option D, fracture with dislocation. The correct answer is option A, hairline fractures are minor cracks, often from stress or repetitive injury. In case of severe muscle strain, the first aid principle is option A, rise, rest, ice, compression, elevation. Option B, massage and heat only. Option C, exercise immediately. Option D, apply an ointment only. The correct answer is option A, rise, rest, ice, compression, elevation. Rise reduces swelling, pain, and promotes healing in soft tissue injuries. A cast is used to option A, immobilize fractured bone for proper healing. Option B, promote movement. Option C, increase circulation. Option D, massage muscles. The correct answer is option A, immobilize fractured bone for proper healing. Cast provides rigid support to maintain bone alignment during healing. A cast is used to provide rigid support to maintain bone alignment during healing. The first step in case of poisoning is option A, remove the patient from the source of poison. Option B, give food immediately. Option C, induce vomiting in all cases. Option D, apply ice. The correct answer is option A, safety is priority. Removing exposure prevents further absorption. The first step in case of poisoning is remove the patient from the source of poison. In case of injection of corrosive chemicals, the first aid includes do not induce vomiting, rinse mouth with water and seek medical help. Option B, induce vomiting immediately. Option C, give milk in large quantities. Option D, apply oil. The correct answer is option A, do not induce vomiting, rinse mouth with water and seek medical help. Vomiting may cause further esophageal damage and medical care is essential. Vomiting can cause further esophageal damage, medical care is essential. In case of organophosphate poisoning, the first aid step is option A, remove contaminated clothing and wash skin. Option B, give alcohol. Option C, apply ointment. Option D, massage affected area. The correct answer is option A, remove contaminated clothing and wash skin. Reduce further absorption. Antidotes are given in hospital. The first aid for snake bite includes option A, immobilize the affected limb and keep patient calm. Option B, apply tourniquet tightly above bite. Option C, cut and suck out venom. Option D, apply ice directly. The correct answer is option A, immobilize the affected limb and keep patient calm. Movement increases venom spread. Immobilization slows systemic absorption. Movement increases venom spread. Immobilization slows systemic absorption. In case of dog or animal bite, the first aid step is option A, wash wound thoroughly with soap and water, seek rabies vaccination. Option B, apply salt. Option C, leave wound open. Option D, apply alcohol only. The correct answer is option A, wash wound thoroughly with soap and water, seek rabies vaccination. Cleaning reduces infection risk. Rabies prophylaxis is critical. The significant danger of poisoning is option A, respiratory or circulatory failure. Option B, fever only. Option B, minor pain. Option D, bruising. The correct answer is option A, respiratory or circulatory failure. Many poisons affect vital systems. Rapid intervention is crucial. The significant danger of poisoning is respiratory or circulatory failure. The first aid for insect stings with allergic reaction includes option A, administer epinephrine if available and call emergency help. Option B, apply butter. Option C, ignore it. Option D, massage sting. The correct answer is option A, administer epinephrine if available and call emergency help. Severe reactions can be life-threatening. Epinephrine reverses symptoms. Severe reactions, anaphylaxis can be life-threatening. Symptoms of poisoning include option A, vomiting, dizziness, drowsiness, difficulty breathing. Option B, only headache. Option C, only fever. Option D, only redness. The correct answer is option A, vomiting, dizziness, drowsiness, difficulty in breathing. Systemic symptoms alert to possible poisoning. Early recognition saves lives. In case of carbon monoxide poisoning, the first step is option A, move patient to fresh air. Option B, keep in closed room. Option C, apply ice. Option D, give milk. The correct answer is option A, move patient to fresh air. Carbon monoxide displaces oxygen. Fresh air reduces hypoxia until medical care. In case of carbon monoxide poisoning, the first step is move patient to fresh air. The best way to prevent poisoning at home is option A, store chemicals, drugs and pesticides safely out of children's reach out. B, leave chemicals open. Option C, mix chemicals. Option D, keep drugs in bathroom. The correct answer is option A. Prevention includes safe storage and proper labeling. The best way to prevent poisoning at home is store chemicals, drugs, pesticides safely out of children's reach. Shock is primarily caused by option inadequate blood flow to organs, option B eye fever, option C headache, option D minor cuts. The correct answer is option A inadequate blood flow to organs. Shock reduces tissue perfusion leading to organ failure if untreated. Shock is primarily caused by inadequate blood flow to organs. The first aid for shock includes option A, lay patient flat, elevate legs, keep warm and call emergency help. Option C, sit patient upright. Option C, give food immediately. Option D, apply massage only. The correct answer is option A, lay patient flat, elevate legs, keep warm and call emergency help. It improves blood flow to vital organs and prevent deterioration. Hypoglycemic shock occurs due to Option A, low blood sugar. Option B, high blood sugar. Option C, high blood pressure. Option D, low temperature. The correct answer is option A, low blood sugar. Insufficient glucose can cause confusion, sweating, and loss of consciousness. Hypoglycemic shock occurs due to low blood sugar. Insufficient glucose can cause confusion, sweating, and loss of consciousness. First aid for hypoglycemic shock in conscious patient. Option A, give oral sugar solution or glucose tablets. Option B, give insulin. Option B, Option C, restrict foods. Option D, apply cold compress. The correct answer is option A, give oral sugar solution or glucose tablets. Rapid glucose restores blood sugar and prevents progression to unconsciousness. The first aid for hypoglycemic shock in a conscious patient is: first aid for seizures include: option A, protect patients from injury, do not restrain place on side. Option B, hold patient tightly. Option C, put objects in mouth. Option D, give water immediately. The correct answer is option A, give protect patient from injury, do not restrain place one side. Safety and airway protection are priorities. Do not force anything into mouth. First aid for seizures include: protect patient from injury, do not restrain place on side. In case of heart attack, the first aid includes: option A, call emergency services immediately, keep patient calm and seated or lying. Option B, make patient walk. Option C, give alcohol. Option D, apply massage. The correct answer is option A. Early medical care reduces heart damage. Rest reduces strain on heart. Early medical care reduces heart damage. Rest reduces strain on heart. Anaphylaxis is a: option A, severe allergic reaction causing air compromise and shock. Option B, mild rash. Option C, muscle pain. Option D, headache. The correct answer is option A, severe allergic reaction causing airway compromise and shock. Immediate epinephrine and emergency care are life saving. In case of stroke, the first aid includes: option A, call emergency help immediately, keep patient comfortable and monitor vitals. Option B, give water. Option C, make patient walk. Option D, apply massage. The correct answer is option A, call emergency help immediately, keep patient comfortable and monitor vitals. Rapid medical intervention is crucial to reduce brain damage. Rapid medical intervention is crucial to reduce brain damage. Hypertensive emergency first aid includes: option A, calm the patient, seek urgent medical care. Option B, give painkillers only. Option C, make patient exercise. Option D, apply cold compress. The correct answer is option A, calm the patient and seek urgent medical care. Sudden high blood pressure may cause organ damage. Immediate care is needed. Sudden high blood pressure may cause organ damage. Immediate care is needed. Syncope, fainting can be managed by: option A, laying patient flat and elevating legs. Option B, making patient stand. Option C, giving water orally. Option D, shaking the patient. The correct answer is option A, laying patient flat and elevating legs. Improves blood flow to brain and prevents injury from falling. Syncope can be managed by laying patient flat and elevating legs. Asthma attack first aid includes: help patient sit upright, assist with inhaler, keep calm. Option B, lay flat. Option C, give water. Option D, apply massage. The correct answer is option A, help patient sit upright, assist with inhaler, keep calm. Upright position eases breathing, bronchodilators relieve bronchospasm. Upright position eases breathing, bronchodilators relieve bronchospasm. spasm. Epileptic seizure lasting more than 5 minutes is called. Option A status epilepticus. Option B partial seizure. Option C absent seizure. Option D simple seizure. The correct answer is option A status epilepticus. Requires urgent medical attention to prevent brain damage. Requires urgent medical attention to prevent brain damage. For asthma or anaphylaxis, the immediate medication is option A epinephrine for anaphylaxis or bronchodilator inhaler for asthma. Option B insulin. Option C antibiotics. Option D antipyretics. The correct answer is option A epinephrine or bronchodilator. Rapid administration relieve airway obstruction and prevent deterioration. Cardiac arrest first aid focus on option A early CPR and defibrillation. Option B giving food. Option C massaging limbs. Option D applying ointment. The correct answer is option A early CPR and defibrillation. Maintaining circulation and oxygenation until advanced care improves survival. Cardiac arrest first aid focus on early CPR and defibrillation. In case of unconscious with the breathing, the patient should be placed in option A recovery position, option B sitting upright, option C supine with head flat, option D standing. Recovery position maintains airway and prevent aspiration. In case of unconscious with breathing, the patient should be placed in recovery position. Heat stroke is characterized by option A high body temperature, option A skin confusion, highly option B cold skin shivering, high option C mild headache, option D nausea only. The correct answer is option A high blood temperature, hot dry skin confusion. Heat stroke is a life threatening emergency caused by failure of thermoregulation. Rapid cooling is essential. Heat stroke is a life threatening emergency caused by failure of thermoregulation. Rapid cooling is essential. First aid for heat stroke includes move patient to cool place, remove excess clothing, cool with water, and call emergency help. Option B give hot drinks. Option C keep patient in sun. Option D apply tight bandages. The correct answer is option A. Cooling reduces core temperature and prevents organ damage. First aid for heat stroke includes move patient to cool place, remove excess clothing, cool with water, and call emergency help. Heat ex- heat exhaustion symptoms include option A weakness, dizziness, nausea, heavy sweating. Option B confusion and dry skin. Option C only headache. Option D shortness of breath. The correct answer is option A weakness, dizziness, nausea, heavy sweating. Early recognition prevents progression to heat stroke. Heat exhaustion symptoms include weakness, dizziness, nausea, heavy sweating. First aid for heat exhaustion. Option A move to cool place, loosen clothing, give slips of water. Option B apply ice directly on skin. Option C make patient exercise. Option D keep in sun. The correct answer is option A cooling and hydration restore body fluids and prevent worsening. First aid for heat exhaustion is move to cool place, loosen clothing. Hypothermia occurs when body temperature falls below. Option A 35 degrees Celsius. Option B 37 degrees Celsius. Option C 40 degrees Celsius. Option D 32 degrees Celsius. The correct answer is option A 35 degrees Celsius. Core temperature below 35 degrees Celsius impairs organ function. Rewarming is needed. Hypothermia occurs when body temperature falls below 35 degrees Celsius. Core temperature below 35 degrees Celsius impair organ function. Rewarming is needed. First aid for mild hypothermia includes option A. Move patient to warm place. Remove wet clothing. Cover with blankets. Option B. Apply cold compress. Option C. Give ice water. Option D. Expose to wind. The correct answer is option A. Move patient to warm place. Remove wet clothing. Cover with blankets. Gentle warming and insulation restore body temperature safely. Gentle warming and insulation restore body temperature safely. Frostbite effects. Option A. Extremities such as finger, toes, ears, and nose. Option B. Abdomen. Option C. Eyes only. Option D. Chest. The correct answer is option A. Extremities such as fingers, toes, ears, and nose. Peripheral tissues are most prone due to cold exposure. Rewarming is critical. Peripheral tissues are most prone due to cold exposure. Rewarming is critical. First aid for frostbite includes option A. Gradual warming with warm water 37 to 39 degrees Celsius and avoid rubbing. Option B. Massage vigorously. Option C. Apply snow. Option D. Apply alcohol. The correct answer is option A. Gradual warming prevents tissue damage. Rubbing may worsen injury. Gradual warming prevents tissue damage. Rubbing may worsen injury. Sunburn prevention includes option A. Using sunscreen, wearing protective clothing, and avoids peak sun hours. Option B. Applying butter. Option C. Exposure to sun for long hours. Option D. Ignoring sun exposure. The correct answer is option A. Using sunscreen, wearing protective clothing, and avoid peak sun hours. Sunscreen and clothing reduces UV damage, ultraviolet damage. Sunscreen and clothing reduces UV, reduce ultraviolet damage. Heat cramps occurs due to option A. Loss of electrolytes during heavy sweating. Option B. Cold exposure. Option C. High blood sugar. Option D. Low blood pressure only. The correct answer is option A. Loss of electrolytes during heavy sweating. Replenishing fluids and electrolytes relieves painful muscle cramps. Heat cramps occurs due to loss of electrolytes during heavy sweating. Replenishing fluids and electrolytes relieves painful muscle cramps. First aid for foreign object in the eye includes option A. Flush the eye with clean water or saline. Option B. Rub the eye vigorously. Option C. Apply ointment immediately. Option D. Cover with a tight bandage. The correct answer is option A. Flush the eye with clean water or saline. Flushing helps remove debris. Rubbing can cause corneal injury. Flushing helps remove debris. Rubbing can cause corneal injury. Chemical splash in the eye should be treated by option A. Immediate irrigation with large amounts of water at least 15 to 20 minutes. Option B. Applying ointment. Option C. Rubbing the eye. Option D. Leaving it open to air. The correct answer is option A. Immediate irrigation with large amount of water for at least 15 to 20 minutes. Rapid dilution reduces tissue damage. Seek medical attention promptly. Nosebleed epistaxis first aid includes option A. Pinch the soft part of the nose and lean forward. Option B. Tilt head back. Option C. Apply ice to forehead only. Option D. Blow nose forcefully. The correct answer is option A. Pinch the soft part of the nose and lean forward. Leaning forward prevents blood from entering throat. Direct pressure controls bleeding. Ear injury with a foreign object should be handled by option A. Seeking professional removal. Avoid probing with tools. Option B. Using cotton swabs aggressively. Option C. Flushing with hot water. Option D. Applying ear drops. The correct answer is option A, seeking professional removal, avoid probing with tools. Improper removal may damage eardrum or canal. Professional care is safest. In case of minor conjunctivitis, first aid includes option A, keep eye clean, avoid touching, use prescribed eye drops. Option B, rub eye frequently. Option C, apply ointment without cleaning. Option D, ignore symptoms. The correct answer is option A, keep eye clean, avoid touching, use prescribed eye drops. Hygiene and appropriate medication prevent worsening and spread. In case of minor conjunctivitis, the first aid includes keep eye clean, avoid touching, use prescribed eye drops. Prevent worsening and spreading. In case of earthquake, the first action is option A, drop, cover and hold on. Option B, run outside immediately. Option C, stand near windows. Option D, use elevator. The correct answer is option A, drop, cover and hold on. Protect from falling objects and reduce injury risk during tremors. In case of earthquake, the first action is drop, cover and hold on. In case of flood, safety first aid includes move to higher ground and avoid floodwater. Option B, swim in strong currents. Option C, walk contaminated water. Option D, stay in basement. The correct answer is option A, move to higher ground and avoid floodwater. Floodwaters may contain debris, chemicals and pathogens. Higher ground reduces risk. In case of flood, safety first aid includes move to higher ground and avoid floodwater. In lightning strike emergency, the first action is option A, move the victim to safe location and start CPR if necessary. Location and start CPR touch if victim necessary. Immediately during storm. Option C, leave victim outside. Option D, apply ice immediately. The correct answer is option A, move the victim to safe location and start CPR if necessary. Lightning can cause cardiac arrest, ensure safety and provide immediate life support. In lightning strike emergency, the first action is move the victim to safe location and start CPR if necessary. In case of hurricane or storm, the first aid principles include option A, evacuate to safe shelter and avoid debris. Option B, stand near windows. Option C, stay outdoors. Option D, swim in rivers. The correct answer is option A, evacuate to safe shelter and avoid debris. Shelter in safe areas prevent injuries from flying debris and structural collapse. Shelter in safe areas prevent injuries from flying debris and structural collapse. In case of food poisoning outbreak, first aid includes option A, hydrate with ORS and seek medical care. Option B, give solid food immediately. Option C, apply topical ointments. Option D, avoid fluids. The correct answer is option A, hydration with ORS and seek medical care. Dehydration prevents dehydration. Medical evaluation ensures proper treatment. In case of chemical spill in environment, first aid includes option A, evacuate area, remove contaminated clothing, wash skin thoroughly. Option B, remain in the area. Option C, apply ointment. Option D, mix chemicals. The correct answer is option A, evacuate area, remove contaminated clothing, wash skin thoroughly. Reduces chemical exposure and prevents further injury. In case of chemical spill in environment, first aid includes evacuate area, remove contaminated clothing, wash skin thoroughly. In case of fire emergency, first aid includes stop, drop and roll if cloths catch fire, evacuate safely, run with burning cloths. Option C, spray water on face only. Option D, jump from height immediately. The correct answer is option A, stop, drop and roll if cloths catch fire, evacuate safely. Rolling extinguishes flames and prevents burn. Safe evacuation is essential. In case of hyperventilation during panic attack, first aid includes option A, calm the patient, encourage slow breathing or use paper bag technique. Option B, ignore patient. Option C, make patient run. Option D, apply ice. The correct answer is option A, calm the patient, encourage slow breathing, or use paper bag technique. Slowing breathing restores normal carbon dioxide levels and reduces symptoms. Slowing breathing restores normal CO2 levels and reduce symptoms. In case of traumatic injuries during disaster, the priority is option A, ABC, airway breathing circulation. Option B, moving patient quickly without assessment. Option C, ignoring minor injuries. Option D, applying ointment only. The correct answer is option A, follow airway breathing circulation. Ensure life-threatening conditions are addressed first before secondary injuries. In case of traumatic injuries during disaster, the priority is assess airway, breathing, and circulation. The general principle of first aid during any disaster is option A, ensure personal safety, assess situation, provide life-saving interventions, and call for help. Option B, rush to rescue without planning. Option C, ignore hazards. Option D, focus on only on property. The correct answer is option A. Safety, assessment, and priority of life-saving care are essential in disaster. Thank you all. My dear students, if you like my content, please subscribe my channel. Thank you.